PhilHealth officials were grilled yet again during today's House hearing on the proposed 2021 budget. This after a lawmaker flagged the agency's supposed overbilling government for premium contributions. Ria Fernandez with the details.
Marikina 2nd District Representative Stella Quimbo flagged PhilHealth's initial request of some 41 million Filipinos who are covered by law for a free health insurance. In the House budget hearing, Quimbo said such proposal was indicated under PhilHealth's first budget proposal worth 138 billion pesos. But this was removed when the Budget Department only approved the state insurer 71.3 billion pesos for 2021.
Pasalamat po tayo sa DBM at sila po ay nag-alerto po at nakita nila kaagad itong tila overbilling po ng PhilHealth.
PhilHealth Actuary Chief Nerissa Santiago tried to explain their computation.
Maaari pong isinama namin dito na makakasama po sa makaka-receive ng benefits or yun po mga hindi pa naka-register sa atin sa PhilHealth na mga miyembro na wala pang bayad na maaaring walang kakayanan na magbayad po.
But Quimbo said DSWD's list of indigents only totals to 28 million, which is far from PhilHealth's 41 million intended beneficiaries. The state health insurer says they also accounted those that are not yet registered, including those that became automatic members through point of service. Despite corruption issues with PhilHealth, the health department will center a big chunk of its proposed 203.74 billion pesos to universal health care. Health Secretary Francisco Duque III expressed openness to the idea of putting up PhilHealth offices abroad to boost collection. Newly installed PhilHealth Chief Dante Gueran, who claimed to be more experienced in finance and management, also vowed to familiarize himself with public health.
One need not be a doctor to be a public health manager or expert.
Meanwhile, in the same hearing, the DOH denied anew the downgrading of nurse positions in government in view of the implementation of pay hike for the field's entry level. From the previous 22,000 pesos, starting nurses now receive 32,000 pesos or salary grade 15. This, however, affected the Nurse 2 position, which has the same pay. To resolve this, the DOH suggested to DBM to immediately raise salary of Nurse 2 to Step 8 amounting to 34,000 pesos. Deputy Speaker Henry Oaminal is willing to defend such provision for nurses when they take up the agency's budget in the plenary. But the DOH budget was stalled at the committee level after a Nakalusugan Representative Mike Defensor found the agency's response to his queries on Health Facilities Enhancement Program unsatisfactory. For News 5, Ria Fernandez, We Are One News.